Hi, my name is Mohammed Al-Hijji. I'm one of the interventional cardiology fellows specialized in structural heart disease at Mayo Clinic in Rochester. I will summarize my article titled Circulating Osteogenic Progenitor Cells in Mild, Moderate, and Severe Aortic Valve Stenosis that will appear in the Journal of Mayo Clinic Proceedings. This article highlights important aspects in aortic valve degeneration and calcification. Patients with different stages of aortic valve stenosis were screened and blood samples were obtained after informed consent. We then analyzed the blood for circulating progenitor cells, and we defined those by the availability of cell markers such as CD34, KDR, and the early progenitor marker CD133. First, our study demonstrated the presence of different endothelial progenitor cells with osteogenesis potential, and we defined those by the presence of the osteogenesis marker called osteocalcin and the circulation at earlier progressive stages of aortic stenosis, such as in the stages of mild to moderate aortic valve stenosis. During the progression to severe aortic valve stenosis stage, higher abundance of different subtypes of progenitor cells with the osteogenesis potential were seen in the circulation. In general, we found that there was four-fold increase in total circulating early progenitor cells with osteogenesis potential in patients with severe aortic valve stenosis compared to mild aortic valve stenosis. We further demonstrated the expression of those markers in aortic valve tissue using immunofluorescence staining. It may be concluded that our results add to existing evidence that support the potential role of circulating endothelial progenitor cells with osteocalcin or osteogenesis potential that are likely derived from the bone marrow in aortic valve calcification, pathogenesis, and progression. Patients with aortic stenosis are currently monitored till they develop severe symptomatic obstruction. The only available treatment options are transcatheter or surgical aortic valve replacement. There are currently no available medical treatment that halt or slow down the progression of aortic valve calcification. Our study adds to the existing literature some of the potential pathways leading to aortic valve stenosis. Additional longitudinal studies will be needed to assess the effect of elevated circulating endothelial progenitor cells with osteogenesis potential to confirm our findings and results. In the future, agents targeting progenitor cells with osteocalcin marker might be effective in halting the progression of aortic stenosis if applied at earlier stages of aortic valve disease. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.